I'd like to welcome all you guys in Jordan. At the same time, people who knows me know that I've been, over the last 2 years, attached to the cause of Gaza. Less than 145 kilometers. There's an ongoing genocide happening right now. I had the honor to be there for total 4 months, 3 missions, more than 200 complex surgical procedures. And since then, people who knows me, that had really changed me a lot over the last 2 years. Less than 140 kilos away from here, more than 67,000 people were killed, more than 170,000 injured. And as you guys know, hospitals have been destroyed and people are really struggling. Since the ceasefire for the last 40 days, there's been a ceasefire. More than 300 people were killed. And last night, only 24 people, civilians, children, were also killed by the Israeli army, despite the ceasefire. This is a 78-year-old with upper GI bleeding, massive upper GI bleeding. She had 4 units drop in her hemoglobin. This is a BMI about 41, and this is her EGD. You can see this very large mass just below the GE junction, as even like you can maybe see if it's pedunculated from the GE junction. So she was seen at that time, stabilized, giving blood. Endoscopy showed no active bleeding, and CT scan done showed no metastasis. And so these are the options that were offered to this patient by different surgeons. They've seen maybe 3 or 4 surgeons before they saw me. Some had offered their total gastrectomy. Some they offered her vagal preserving proximal gastrectomy. And some had offered the patient to receive upfront imatinib. The family were against any medical treatment. They said basically we need some sort of surgery. They came to my clinic, although she was actually an inpatient. Do anything else. So we fired the stabler. We got the region out. We placed it in a bag. And then now we had this large gastrostomy that I selected to close it as a form of sleeve gastrectomy. This is a morbidly obese patient, and I have good experience where I utilize the sleeve gastrectomy in oncological procedures, especially in morbidly obese patients, that will give you both the oncological principles as well as the benefit. And at the end of the day, we should not forget about our brothers and sisters in Gaza. Dr. Hussam al-Safi has been there in custody. They took him from the hospital in Kamal Adwan for almost now 4.5 months. And this is something we should always keep talking about. Thank you.